Started with gambling, hypersexuality, just generally anything that involved risk taking. At the time of carrying out the behaviours, it was less about the activity and more about the excitement and the thrill.
Impulsive behaviours manifest in a variety of ways. In some people they can be very subtle. Some people just start doing hobbies that they always did a bit more often. Beyond that, there are varieties of behaviour which cause more concern. We've had some patients who start to shop obsessively and start to spend very large amounts of money. We've had others who start to gamble. We also see a change in sexuality in patients. And some patients become hypersexual, and that causes difficulty in their relationship with their spouse. So we must see impulse control disorder as a very broad spectrum of behaviours, from fairly mild behaviour that can be tolerated to extremes of behaviour which can be very detrimental to a relationship and to an individual.
Well, the risk factors for impulsive and compulsive behaviour are being young, being male, having early onset Parkinson's disease, having a personal or family history of previous addictive or impulsive behaviour, and also probably having some affective disorders such as depression or panic attacks or anxiety can also predispose people to impulsive or compulsive disorders.
There's a family history of alcoholism and gambling on my mother's side of the family. My grandfather was a gambler. I had an uncle who was an alcoholic, and another uncle who was a gambler. So there is definitely some history there. My father also had a drink problem. I didn't have a drink problem and I didn't have a gambling problem, but there clearly was some genetic tendency towards that, added to the fact that my age, I was single. I fitted a profile of somebody that was quite a high risk to those potential issues.
Yes, I mean, I have to accept that this is a development of what I describe as the shopping gene that I inherited from my father and he from his mother. There is a family trait of shopping that unfortunately one of my sons has acquired as well. And so I can see that I had the tendency beforehand, but it is different. It feels different. I've been taking them now for many years. Yes, they've caused problems, but they've also helped me still be mobile, still be active, still to be doing what I'm doing with Parkinsons UK. Generally, after 18 years since diagnosis, I'm not in bad shape, and those drugs have helped me. So be cautious, but don't be frightened.
I'm not totally sure whether it is that treatment or whether this is willpower or whether it's a slow version of the condition that she has, but she's doing remarkably well for being this number of years into the diagnosis. So I would say to them, there are real upsides to taking this, but you've got to be very aware of the downside.
It's always important to include a spouse or a partner in discussions about impulse control disorder. The main reason is that the patient is not aware of these behaviours. They are not doing it on purpose. Often they're the last to know. These are subconscious behaviours. So it's vital to have a spouse involved right from the start, because in a sense they're the clinician's eyes and ears on the ground. They're the people who are going to tell you if there's a disorder, because patients are often the last people to tell you about it.
The compulsive behaviour developed slowly, and I think it took my husband to point out that I was getting to behave a bit irrationally and not in ways that I used to behave. So it crept up insidiously rather than suddenly happening.